Can you talk about a mastectomy?
So a mastectomy is removing breast tissue to varying degrees to help surgically treat breast cancer. So I'm going to go back to breast reduction really quickly. So with the breast tissue that's taken out, we send that to pathology to make sure there's nothing crazy in it. Because you can, have your mammogram beforehand and not see anything. Send the breast tissue for breast reduction to make sure there's no, abnormalities, things that could turn into breast cancer. But a mastectomy is where you are actually removing breast tissue to help, again, surgically treat breast cancer. So whether that is just a lumpectomy, where you are taking out the area of breast cancer with a healthy margin, where you're trying to conserve as much of your breast as possible, where there's some patients are like, no, if I can keep as much of my breast as, possible, I just want to do that. That's a lumpectomy. But a mastectomy is where you're actually taking out all of the breast tissue and leaving the skin and fat, maybe or maybe not keeping your nipple. If it's close to your nipple, then it may not be safe to keep it because you can have, tiny bits of breast cancer that may be along close to that nipple. And then follow that up with reconstruction. So there are, again, just like we're talking about, there's varying degrees of like breast lift, breast reduction. There are different things that may be options if you have been diagnosed with breast cancer to help treat it. There's a surgical portion, and then you can have radiation therapy, chemotherapy,